Hi, I'm Dr. Norton. I've got a patient here named Mike who has fallen, and we're going to see if we can clear his cervical spine. We're going to be using the Nexus criteria, and one of the first things we want to do is make sure that he is actually alert and oriented and is able to respond to us and is able to answer our questions. Mike, what happened to you?
I fell.
Do you feel like you're confused at all?
No.
Do you have any alcohol or drugs on board?
No.
That's important because you want to make sure your patient's not intoxicated. An intoxicated patient can't really give you a good exam and you can't really clear their spine. Do you feel like anything's hurting, Mike?
No, just my butt from where I fell.
I'm sorry. And then the next thing that we're going to do is make sure Mike doesn't have any neurologic deficits. Mike, do you feel like you can feel everything everywhere when I touch you?
Yes.
You have normal sensation when I touch you down here in
Yep,
your feet and your hands?
Yep.
Can you give me a good grip? Fantastic. You have good strength there, and I'm going to check the strength in his feet as well. Mike, can you push down for me and push up for me? Fantastic. So he's neurologically clear. So the next thing I'm going to do, we've made sure that he's not intoxicated, he's alert, he's oriented. Do you know where you are right now?
I'm at the hospital.
Good. You know what day it is today?
It's Thursday.
Good enough for me. And he's got no focal neurologic deficits. You didn't feel like you hurt yourself anywhere else?
Nope.
Don't feel like you have any broken bones?
Nope.
Okay, and that's important because we want to make sure he doesn't have a major distracting injury like a broken bone somewhere else in his body. So the next thing we're going to do is to move on to actually examine his neck. So we're at a point where we can now clear Mike's cervical spine using the Nexus criteria. We've already made sure that he doesn't have a distracting injury, he's oriented, he's not intoxicated, he has no focal neurologic deficit. So we're moving on to the portion of the exam where we can take the collar off and examine the spine. Mike, please don't move. I'm going to stabilize your head here with one hand. I'm going to gently remove the collar. And then I'm going to examine your spine. Does it hurt when I push up on your spine here?
No.
How about here?
No.
How about here?
No.
How about here?
No.
Excellent. So I've moved all the way down the cervical spine and nothing hurts. Now we're going to take him through a range of motion because we want to assess for any ligamentous injury. Mike, can I ask you to turn your head gently side to side and see if anything hurts in back when you do that? Does that bother you?
No.
And I'm going to have you gently lift your head off the bed. Does that bother you at all?
No.
And then I'm going to ask you to extend your head up and look up towards the sky. Very good. Does that bother you at all?
No.
Excellent. So he is now clear using Nexus criteria. We can take the collar off and he doesn't need any imaging. If any of that had been concerning, if he'd experienced any pain with any of that, we would put the collar back on and send him for a cervical spine CT scan. Thank you, Mike.